Well, we know that a large portion of our community struggles with access to basic medical care, those family wellness visits and preventive exams, right? But specialty care can be even further out of reach. Primary One Health has long been on the front line to breach those barriers, and now they have a new partner in this. AndHealth is joining forces with Primary One to bring in-house whole person specialty care. So here to explain more, we have Primary One CEO Charleta Tavares and Matt Scantland, the CEO of AndHealth. So both of the partners in this, it is great to have you here.
It's great to be here.
Great to be here. Thanks.
All right. Yeah, absolutely. Charleta, I want to talk about this new partnership because Primary One has been right on this mission for so long now. What is it about, this that made you think this is the right move? What are you doing to try to help the community you serve?
I think listening to our Chief Medical Officer, Dr. Marable, share with us how long it's taking to get our patients into specialty care, those with migraines or various kinds of headaches, and those with arthritis or various other conditions that they just can't get in to see a specialist. Yeah. And so when Matt Scantland and AndHealth approached us, we really wanted to take a look at how we can partner and provide these services to our patients.
And so let's go to you for that, Matt. You, as I said in the intro, this whole person specialty care, what is that? What does that mean, to somebody who might not be familiar?
Yeah, whole person care means to support the whole patient in a patient-centered way, to understand that our health comes not just from traditional medicine, but supporting the social and emotional needs of the patient, things like how we eat and how we sleep and how we manage stress. And historically, the way that we've organized our healthcare system, we've really compartmentalized and we've treated each organ system in the patient. And that's especially important in specialty care, where patients tend to get specialty care at a hospital. And as we know, hospitals are very compartmentalized. And so what we're doing in this partnership with Primary One is we're bringing specialty care into the patient-centered medical home, where we can support not just the traditional standard of care for each specialty, but we can actually support the whole patient. Everything from what we're doing with managing chronic diseases that are normally managed by specialists, to being able to work with primary care providers, mental health providers, things like nutrition and sleep and health coaching as well.
And so under that kind of category or under that specialty care, what are the kind of departments that you guys are able to address?
Yeah, so we're able to do rheumatology and dermatology and neurology. And those are specialties that are historically very, very challenging for patients to access, typically a year, and in the medically underserved population, even longer.
I was going to say all of these, right? I mean, people are waiting months at the very least.
Months at the very least, and we're able to combine that also. These are patients that often need specialty medications, and specialty medications are relatively new to our healthcare system, but about 80% of specialty medications actually go through specialty pharmacy. And until these type of partnerships that we're working on with community health centers like Primary One, specialty medications weren't available under the sliding fee scale of the community health center. And so when we bring specialty care and specialty pharmacy into the community health center, patients are able to get access to care that's increasingly important in a world where 80 or 90% of the suffering in our healthcare system is actually patients with chronic diseases.
Wow, yeah.
You look at the cost, because our patients have barriers to health care.
Sure.
Social, economic, and cultural barriers to health care. And so if you can bring the specialty care, you can bring the pharmacy into the picture, then the patient gets well sooner, and they don't have to struggle with taking off from work and having attendance problems. This is just one more way that we can provide the access to the services that our patients need.
And so when somebody does come in, Charleta, a patient that has been with Primary One before and, discovers that they have something, they get a diagnosis, how does that work in kind of conjunction with AndHealth?
Well, AndHealth is right in our health centers.
Okay.
And so their specialists are there. They also have the ability to use telehealth to connect with our patients as well. So they're working with our pharmacists, they're working with our nutritionists to make sure the patients are eating the way they need to be eating, and that they're getting the specialty pharmacy drugs that they need for whatever their condition is.
And Matt, as you talk about this partnership, you talk about, I know you even mentioned you're working with other community-based health centers. Do you see this as being kind of the start of this grander mission to, bring access to everybody in the same way?
Yeah, like our partner at Primary One, we believe that health should be a human right. And in order to achieve that dream, we need to make healthcare much more accessible.
Yeah.
And so we're working with community health centers to help them become clinically broader and more integrated into the healthcare system, and to really to transform how our healthcare system comes together to meet the needs of medically underserved patients and patients with chronic diseases. And when we do that, the great thing is this is a problem that we can make a lot of progress on. We're now able to see patients, 92% of patients in this model are able to have their first visit within 2 weeks.
That's incredible.
Yeah,
That's incredible.
and on average, per month, we're interacting with patients 10 times a month.
Wow.
And that's by providing both on-premise options at Primary One, 13 locations in the community, very accessible, and then also providing virtual options.
Yeah.
And just like all of us these days, we don't just pick one format. We need to support the patient in the way that they want to work with us, and so we do that in this model.
All right, I want to send people primaryonehealth.org. We know that website. Also, AndHealth.com. You can learn all about this partnership, and of course, find a location, a Primary One location near you here in Central Ohio. So congratulations. Thank you so much for what you're doing.
Thank you.